Continue on Buckingham Avenue for 3/4 of a mile. Continue for 1.5 miles.
In the pandemic. That is what Chief Medical Officer Chris Whitty will tell a virtual press meeting at 11 a.m. He will be appearing alongside the government's Chief Scientific Advisor Sir Patrick Vallance. Both will argue the country faces, and I'm quoting here, a very challenging winter period as coronavirus continues to spread across the country. The briefing comes as Boris Johnson prepares to announce fines of up to £10,000 for people who fail to self-isolate for 2 weeks. People who may have coronavirus will be required to self-isolate by law, with those facing up to £10,000, as I said. And yesterday, the Health Secretary, Matt Hancock, warned there could be a second lockdown if the rules continue to be flouted.
The nation faces a tipping point, and we have a choice. And the choice is either that everybody follows the rules, the rule of 6, and the need to self-isolate if you have a positive test or if you're contacted by NHS test and trace, or we will have to take more measures. And I don't want to see more measures, more restrictive measures, but unfortunately, if people don't follow the rules, that's how the virus spreads.
Now in London, the verdict is from the Mayor of London, Sadiq Khan, that the city is catching up with the rest of the country in terms of the outbreak. He's meeting council leaders today and look at what specific measures could be introduced here in the capital. The problem for the government across the country, of course, is that 20%, just 20% of those reporting symptoms in England are self-isolating for that full 2 weeks. And so from next Monday, fines will start at £1,000, rising to £10,000 for repeat offenders. But there will be a £500 incentive for those on low incomes to self-isolate if they cannot work from home. Labour leader Sir Keir Starmer said he would support the government. However, he said the rising rate of infections was caused by the failing testing regime.
I don't think a national lockdown is inevitable. I think it's more likely because testing is all over the place. But I've said to the Prime Minister, you need to take swift action, decisive action. The infection rate is clearly going up. The testing regime is all over the place. And I think one of the concerns I have, and a lot of people have, is that because the government's now effectively lost control of testing, it doesn't necessarily know where the virus is.
The Labour Mayor of Manchester, Andy Burnham, told ABC yesterday the government's messaging had been confusing.
The majority of people are following the rules, and they feel very frustrated, obviously, when others are not. So definitely take action against those who are not. But let's not kind of make this all about it's the public's fault. I don't think it is. You know, they've got confusing messages being given out to them by the government at times. It was all eat out to help out a few weeks ago, and now, of course, it's the opposite.
That's Mayor of Manchester, Andy Burnham, concluding CEO Usherwood's report. Take your views in a moment. Let's get a couple of people there to prompt our conversation. The idea of further lockdowns and those fines as well, which, as you will have seen if you looked at your papers yesterday, could go to some £10,000. You'd have to be a repeat offender, it needs to be stressed, but that does seem to be quite a lot of money. Let's bring the conversation first Labour MP and Shadow Chancellor Annalise Dodds, who joins me now. How is the safety of the nation meant to be balanced with the safety and security of the economy? Shadow Chancellor, good morning.
Good morning, Nick. Well, of course, they both go hand in hand, because ultimately, until this public health crisis is brought under control, it will continue to have enormous economic impacts, and we need to make sure, above all, that just as that clip from Keir indicated, we get a grip on that testing regime. We do all that we can to try and prevent additional restrictions being put into place, because they would have a substantial economic impact.
Tory grandee Sir Bernard Jenkins suggests bringing in the army as regards test and trace this morning. Is that something that you would support?
Well, I think government needs to be looking at all of the options and needs to be very open about where the problems lie. And it's been frustrating to have had almost a parallel conversation about this, where we know from health professionals, I know from my constituents, that they can't access...
In 300 yards, keep right to continue towards Tuns Lane, A355.
Trace and isolate is working. We need to have openness about what's going wrong. There seems to be blockages, particularly in the laboratory capacity. So let's please move forward with a proper plan to deal with this. I think government should be open-minded about how it does that, but above
Keep
all, it
right.
needs to be transparent about where the problems are and do something about them.
Yeah, my question was, would you support bringing in the military?
If that's necessary, I don't think that government should cut off any avenues for dealing with this problem. Of course, the military were used very effectively in order to get that protective equipment out to care homes. If it's necessary to call on their services again, then of course that should be considered. As I said, I don't think government should be ruling anything out at this very important time.
Pardon me. I'm sure, Shadow Chancellor, your eye was drawn to the stories yesterday. There's around 900,000 jobs in the hospitality and bar sector that could be at risk. That is a phenomenal number of people. Is it not time that you and your parliamentary colleagues and all sides of the House had an opportunity to debate any further restrictions?
Well, we do think it's important that we're able to talk about the nature of restrictions going forward, but let's be absolutely clear, and I think I said this on your programme before, I said it time and time and time again, that fundamentally the issue for the UK economy right now is confidence. Obviously, it's about preventing any additional localised restrictions being put in place, making sure that test, trace and isolate are working properly. But the fundamental...
In a quarter of a mile, at the roundabout, take the first exit onto the M4 slip road to London, Heathrow Airport.
On this morning, ways in which government can build that confidence, can make sure that we get back onto a better track, just as is happening in many other countries, because not only are we facing the highest rate of excess deaths in Europe right now, we're also facing the deepest recession in the G7. There's a lot more that can be done to avoid that.
I'm grateful for your time. Thank you, Shadow Chancellor Annalise Dodds, appearing here on LBC where it's 12 minutes after 7. Listening to that consultant anaesthetist and president of the Hospital Consultant Specialist Association, Dr. Claudia Paolini, who joins me now. Doctor, how likely do you think we are going to look at, let's go absolute to the max, a second lockdown, full lockdown? What do you think, Doctor?
I think on the current